All right, Michael, we're just getting started in your knee here. We're looking kind of up above the kneecap. This is your quad tendon, those white fibers going up and down below. Looks a little inflamed and irritated how red the lining is in the joint up there. And that little white area is a scar of joint lining that some people have. It's called a plica. We don't think it causes any problems. It's up above the kneecap. This is the undersurface of the kneecap here. And that's some early arthritis. That cartilage should be nice and smooth, more like over here to the left. And where you have this more crab meat looking appearance in the middle, that's some early wear and tear there. We'll look down at the cartilage on the opposite side of the joint. And some more early arthritis down there. No surprise there, we knew you had some early arthritis in this knee. Get a picture of that too. Well, we're still up here in the front. We'll see if we can swing over and get a look down the outside part of the knee. All the way back to the back here. Sometimes loose pieces can hang out back in the back. And back in that area there, that's a little tendon that runs in the back of the knee. It's a little bit hard to see in your knee, but that looks fine there. And then we'll come back out to the front and we'll kind of swing our way across over to a similar area on the inside or medial side of the knee. That looks fine in there too. We'll drop the knee down. It was straight. We'll bend it down a little bit. That opens up the knee a little bit in the middle. A lot of that sort of scar tissue in the way. We'll make a second portal here and get to cleaning some of this stuff up so we can take a better look. And that's a little glimpse of your medial meniscus tear there. I'll show you more in a minute. All right, Michael, so now we're in the medial compartment. That's the inside part of the knee. And this big flap of tissue is what we saw in your MRI. This is the kind of meniscus tear that I really think could be symptomatic even in a knee with some arthritis like you have. And this is probably what was really pushing us to do this as much as anything else. We got some fraying on the cartilage here on the inside part of the knee, and if we bend it way back, we see some areas where there's some more significant wear. That's back in the back on the inside part of the thigh bone. Shin bone side, if we look down, has some signs of wear too. No big areas of full chondral loss, no bone on bone areas. Now we'll take a look back in the center of the knee here. I'll bend the knee down again, and this is where we can get a look at your cruciate ligaments usually, but you've got a bunch of scar tissue in the way. We're going to clean this up a little bit. We'll show you better. Take the shaver. Alright, so we got most of that stuff cleaned out. The shiny white fibers that you can see when we pull this other joint lining out of the way, that's your ACL, and it feels good and strong when we probe it. This is your PCL, your posterior cruciate ligament. Back behind that yellow layer, that feels fine too. We'll stash our probe over here, and then we'll try to get a view of your outer compartment next. Alright, so now we're in the outer compartment of the knee. You can see this fray on the side, that's more wear and tear on the cartilage, but this is a kind of a nasty tear of that back part of the lateral meniscus also. So you can pull it all the way up into the middle of this compartment. This is another bad meniscus tear. Over here it looks okay. Just a little fraying at the inner free border. Let me get the little flow going there so we can get a better picture. Alright, so we'll get to work cleaning this up. Alright, so we got this outside looking a bit better. You can see if we look down, there are some areas of pretty significant cartilage loss back in the back on the tibial side. And that lateral meniscus was pretty beat up, but we got it cleaned up pretty well. We'll finish getting some of that back part cleaned up. We want to take a look up at the femur side on the outside part of the knee, and that area actually looks really good. So we'll finish cleaning this up and we'll get over to the medial side. All right, so now we're back on that medial side. This is a little shaver that we can use to kind of suck in loose tissue. It's got a little blade that goes back and forth, you can see there. So we're pulling in that torn meniscus that's back in a flap in the back of the knee and trying to get that out of here. Looks like it's doing a pretty good job of it. We'll keep working on this and we'll show you once we get it looking a little bit better. All right, so we got that big flap out of there. And now we're working on what's left over of the tear in the back. Just trying to even this all the way across so there's no more loose flaps that can catch on you. That's looking good there. We'll go back in one more time with a shaver and kind of clean this up the rest of the way here in a second. That'll loosen it up. Shaver. Turn a little shaver on, that'll suck the pieces in. Smooth out any flaps of tissue that are left back there. Okay, and then we'll get a good picture of that meniscus. And make sure we just smooth out all these flaps of cartilage as well as we can back here. I think we got most of them already. All right, so that looks better. Still have some wear and tear in this thing, but overall, those meniscus tears were both pretty bad. I think getting them cleaned up has a good chance to help you. So we'll get this knee washed out and get you off to recovery here in just a minute. Everything went well. You got any water left? That's okay. I think we got it. We got it. It's good. There was a little bit. All right, Steries. Thank you. And then one more thing of Steries. Thank you. All right, then the injection. And is there 10 more? Alright. Bye. Alright. How about a blue towel? And then the heavies. I'm going to tear down the drapes here.